Hi, this video is the hair transplant restoration surgery on a transgender to create a feminine hairline. She had a procedure done in the past, what they call a scalp advancement, and so basically cut this piece of skin and lower. But this is one of the nicer cases where the healing, the scar, I barely noticed it, while other clients with the scalp advancement surgery where they cut out skin and they suture and lower, you have a really big linear scar. Scalp advancement is the older technique and people don't really do that much because it's more invasive and you have a result into a linear scar and it's more painful and you have numbness along the linear scar. In this case, her scar is fantastic. It's hard to see, but people don't do scalp advancement a lot anymore because hair transplant is more natural and it's less invasive. And even after scalp advancement, you're going to need a hair transplant anyway. So why not do a hair transplant to begin with to lower the hairline? So lower the hairline, the two techniques, you do scalp advancement or do a hair transplant. And if you do scalp advancement, which is more invasive, more painful, more bleeding, more chance of infection, and you have numbness along linear scar, but the scalp advancement, after scalp advancement with the linear scar, you still need a hair transplant to hide it. So nowadays more and more people just do a hair transplant. Creating a feminine hairline is very difficult and it's intricate, but it is an art form. It requires more than just the artistic, more than just the surgical skill of the surgeon. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. Women hairlines, when compared to men hairlines, are different. And the first thing is from the mid eyebrow to the hairline. For average for Asian men or black men, around 6.5 to 7. For Caucasian men, it's around 7.5 to 8.5. But for women, the mid eyebrow to the hairline is roughly around 4.5 to 6.5 centimeter, somewhere in between. It just we use the average height as a guide, but really when we built the hairline, we want to make sure the hairline height is proportional to the overall of the face, a third of a third. Mid eyebrow to the hairline is a third, mid glabella to the tip of the nose a third, tip of the nose to the bottom chin is a third. And then with the the temple is really important. If you can turn this way for me, there we go. With the temple, and you see with it's nice zigzag when they did the scalp advancement, but it leaves like a sharp edge triangle. And for men, the temple is really further back. So where the eyebrows end, for men, you put a finger breadth, and that's where the temple should begin. But this client has her temple hair is a little bit further back. So we will bring it in. Where the eyebrows end, the temple should be in there. Number one rule. So that's how a woman's different from men. Men start further back, a finger breadth back. Number two, the angle of men is pointed backward like this. And then most acute with Caucasian, Asians less, and black men is perpendicular. But for women, the angle is always, doesn't matter what ethnic, the angle is always pointed toward the middle, not backward. Toward the middle of the head. So that's the other rule. And then the other important factor is, you see how that part, and we point it backward, where the eyebrows end, where it begins. So if we don't bring in the temple and just lower the hairline, you have a wide forehead and you have just a low hairline. You have hair, but it still doesn't look perfectly natural. And when you pull your hair back, it doesn't look feminine. So bring in the temple, have the woman feminine temple angle and the height and the distance, which is closer where the eyebrows is, would have it very proportional, then the feminine hairline comes out. And the other important factor is the zigzag is wider than men and higher in height, and it's a bigger zigzag. And the angle of the hair is important. Start around 35, 45 in the front, changes when you go backward, and change when you go sideways. Now the angle of the temple is flat against the skin, pointed down and backward. The other important thing about the temple hair is we try and use more baby hair as much as you can. the more root that grows single hair, the softer the temple is, the more natural it will look. I'm very excited for this client. And she's already a beautiful girl, but what she needs is a more feminine hairline. So in order for her to tie her hair in a ponytail, and with the feminine hairlines, it will enhance her beauty, her eyes, her nose, and all the feminine beauty that comes out. And this is the feminization surgery. It's a form of feminization surgery using the hair transplant to create a feminine hairline. As you know, I'm one of the very few surgeons who specialize in the art of creating a feminine hairline. And we will attempt at least 2,000 or 2,500 grafts, somewhere around here, to recreate the hairline. Thank you.